Hello. Hi, everyone. My name is João. I'm one of the co-founders and executive director of ImpulsoGov, a health tech nonprofit based in Brazil. I was a civil servant back home, raised and born in São Paulo, the largest city in the country, and Brazil is one of the world's most unequal countries too. There, I learned that we are home to the world's largest universal healthcare system, serving over 200 million people. I also learned that we are home to an internationally recognized community healthcare worker program, which means that in Brazil we have 300,000 people, a real army of health workers, with one single job, to visit every single household in the country every month. And I literally mean everywhere, including in the heart of the Amazon forest, for example. I also learned that we are home to the world's, and that's more recent, to the world's largest single-entry healthcare database. We are talking about high-quality data on 170 million people across the country. So that's amazing, because we have people and we have data. For some reason, though, we are failing, and we are failing badly. We are talking about almost 60,000 people dying every single year in Brazil alone, exclusively from the health causes that we work with at ImpulsoGov. This means one person every 10 minutes. Why is this happening? They are dying from preventable causes, like those that you see in the slide. And the reason, in a nutshell, is that we are data-rich, but information-poor. To say in another way, we are collecting all this data and wasting it completely. That's where we plug in. We developed a software that is offered 100% for free, and it's open source, to answer one single question. Who needs healthcare right here, right now? Solution is quite straightforward. We allow each city that partners with us to know exactly who is being left behind right there in each neighborhood. We are talking about lists of unvaccinated kids, pregnant women, delayed and prenatal care, and so on and so forth. Let me make it more concrete. Think about Valdiene. Valdiene is a community healthcare worker in one of the northmost cities of Brazil, Bonfim, in the middle of the Amazon region. By herself, she's supposed to take care of almost 3,000 people and make sure they are on track with their preventive health. That's basically impossible to do without data. Her city, though, partnered with ImpulsoGov, which means that she has, on a daily basis, access to information on who she should be prioritizing. What do I mean is she has, right on her computer, the list of women that never did a cervical cancer screening exam in their lives, for example, in her city. As soon as she manages to get these people to do the exam, our software updates automatically, and she has the new list. That's exciting, and it's more exciting that we managed to do this in 150 cities across the country so far, covering around 1.5 million people. We are also on our path to double this scale, mostly in the Amazon region in the next few months. Exciting, but insufficient, because we have over 1,000 cities waitlisted, which means that organically, 1 in every 5 cities in the country learned about our work, reached out to us, and we are the bottleneck. We have been unable to keep with this demand and scale further. We also know that we are moving the needle. We did an impact evaluation that showed that 50,000 chronic disease patients are now being properly managed and having the right appointments and exams thanks to our product. We also went one step further and we realized we had the opportunity to reach those citizens directly. So we started messaging women that never did a prenatal cervical cancer screening exams in their lives, started receiving WhatsApp messages. With this super simple intervention, we managed to more than double the number of exams. If we had managed to do this only in Brazil, this would mean 2,000 lives saved per year. This is one message in a 1-month period. We also managed to help those community healthcare workers in the most pressing challenge that they report they feel most unprepared to deal with, which is the crisis in mental health. In depression alone, that's one of the places they struggle the most. With our support, we managed to reduce 50% of depression symptoms in 2 major cities in Brazil and track these results automatically. That's why we have ambitious plans. We want to scale much further and reach 90 million Brazilians in the next 3 years. Our hope is to get the federal government to adopt what we are doing as public policy and reach nationwide scale. For that, we need $10 million over the next 3 years to do basically 3 things. First, make our product even better and easier to use and get rid of that wait list. Second, invest more in our mental health product because we know it works. We need it to be bigger and reach more and more people. And then we'll be ready to do the technological and institutional integration so that the federal government can really make this a national priority. Exciting, but it's even better when you think about the rest of the world. We are operating, as I said, in the world's largest healthcare system. But many, many other countries in the world have a community healthcare worker system similar to ours, like those on the map and many others. What we are doing here costs 10 times less than the NHS, the UK health system, spending per person, which means we are getting to developed countries' levels of health outcomes, spending 1/10 of the price. For the Global South, that's an inspiring benchmark because it fits on the pocket. Our hope is to take this not only to Brazil, but elsewhere. We have gathered the best talent in both public and private sector, and also partnered with very important supporters from Brazil and around the globe. Those people and those companies believe in our shared mission. They believe we can turn health data into healthcare so that we can get to 0 preventable deaths in Brazil and beyond. We are talking about saving not thousands of lives in Brazil, but millions of lives across the world. Thank you so much.